Hello, and thank you for taking the time to watch this session on diabetic foot care. We'll start off today by looking at why taking care of your feet when you have diabetes is so important, and then we'll dive into recommendations on how to best do this. As you listen to this session, encourage you to write down any questions that come up for you so that you can take them in to your healthcare provider and get answers to the personalized questions that come up for you. Moving forward with the slides here, addressing the question, why is it important for people with diabetes to care for their feet? Reading off the next slide, nerve damage that can result from high blood sugar levels can lead to a loss of protective sensation, which means you can injure your feet without feeling it. Okay? So let's break this down a little bit. So one of the things that happens when we have diabetes is our body is not able to regulate our blood sugar levels as well. And our bodies function optimally when our blood sugar levels are within a particular range. And when they are too high, it can start to cause different types of damage to our bodies. And one of the types of damage that can come about is damage to our nerves. And there's different things that can result from damage to our nerves, but one of them is that we don't feel pain in the same way. And so this idea of loss of protective sensation means that, you could step on something sharp. Normally, that would feel painful, and that feeling of pain would prompt you to protect your foot, move it away from that sharp thing. But in the face of diabetes, we can lose that protective sensation and step on that sharp thing and not be prompted to protect our foot. Hence the bottom part of the slide there. So you can injure your feet without feeling it. Moving on to the next slide here. Reading the screen, diabetes can also make it harder for wounds to heal. Small cuts can become chronic, non-healing wounds that are vulnerable to infection, which are called diabetic foot ulcers. Okay. So other aspects of our bodies not functioning as well when our blood sugar is not within that optimal range is that our body doesn't heal as well. Our immune system doesn't work as well. So these injuries that we can get and not feel can then really have a hard time healing. And when these wounds are not healing, they become much, much more vulnerable to infection. And again, the term we use to describe that is a diabetic foot ulcer. Now, on to the next slide. Diabetic foot ulcers are a major cause of lower limb amputations, disability, and death with people in diabetes. But a main reason why we're putting together this presentation and hoping that you take the time to watch it is that 85% of diabetic foot amputations are preventable. So by taking care of our feet, we can prevent a lot of these undesirable outcomes. And so that's what we're going to spend most of the time in this short video looking at is what can you do to take care of your feet to prevent these outcomes? As I said, what can people with diabetes do to care for their feet? We're going to look at daily foot care, so what it's recommended to do daily, how to cut your toenails, what to wear on your feet, when to see a healthcare provider, and then what I call lifestyle basics, which is generally looking at how things that are related to diabetes management as a whole positively support the health of our feet. So let's dive in. Daily foot care. What's recommended? First, inspect your feet. If you take nothing else from this presentation, inspecting your feet, I think, is the practice that will best support you in preventing outcomes because you'll be aware of what's happening to your feet. You can see in the image on the screen there of somebody using a mirror to look at the bottom of their feet. I know for many folks, just getting a mirror down there is not realistic. But if you go onto the internet and you search, using a mirror to inspect feet, people have come up with all kinds of creative strategies where they attach a small mirror to the bottom of a stick. So you can get creative with this, so you can see the bottom of your feet. And reading off the screen again here, inspect feet daily for things like blisters, hard skin, wounds, sudden changes in skin color, cracks in the skin, swelling, ingrown toenails, and temperature differences between the feet. Additionally, you want to wash and dry your feet each day, and this is part of preventing infection. So let's look at washing first. So recommended there, wash feet daily with mild soap and warm water, but do not soak feet. And I want to kind of pick apart those recommendations a little bit. The mild soap recommendation is so that you're not using anything that irritates the skin on your feet. Warm water is, again, because of that potential risk of loss of protective sensation, right? So putting your foot under really hot water and feeling like, oh, that's too hot, is your body protecting you. And we can lose that reaction response because of the nerve damage that can happen in diabetes. So the warm water, so we don't risk burning ourselves. And why not soaking feet? Two reasons. The first is if you have a wound, soaking it can further hinder the body's capacity to heal. And secondly, something else that happens with diabetes is the skin tends to get drier. And if you soak your feet regularly, that can start to pull away the natural oils from your skin, which can make the feet even drier. And when the skin is drier, it's more likely to crack, and cracks can lead to wounds as well. After washing your feet, you want to make sure that you dry them well, especially between the toes. And the reason for that is because moisture between the toes can increase the risk of infection. You also want to moisturize your feet. And so this is related to what I was saying earlier about the feet getting dry and then dryness potentially leading to cracking. Recommended to use moisturizer without irritating ingredients, again, so that it doesn't bother the skin. Moisturize the top and bottom of the foot, but not between the toes. And again, that's because of the risk of moisture between the toes, increasing risk for infection. So that's what we want to look at daily. Next piece is how to cut your toenails. Before I look at the how-to, want to acknowledge that not everybody has the mobility or the vision capacity to be able to cut their own toenails. There are nurses that provide foot care, but their services are not currently funded by the medical services plan. So if that's a support that you need, that you don't have the finances to cover or extended health benefits to cover, please talk to your healthcare provider about what kind of resources and support might be available in your community. If you are able to cut your toes on your own or have somebody in your life who is able to cut your toenails, what is recommended first is you cut straight across and avoid cutting too short. The reason for cutting straight across is because if you cut in a kind of curved way, you actually increase the risk of ingrown toenails, where your toenail grows into your skin. And avoid cutting too short because you want to minimize the risk of injuring yourself with the nail clippers. And then because cutting straight across can leave some sharp corners, recommended to use a nail file there to smooth out the edges. Looking now at what to wear on your feet, and there's a lot of recommendations in this section. And so I want to just pause for a moment and just encourage you to take everything that you're learning in this session as just an opportunity to do some things, right? That you don't have to suddenly start doing everything and get it perfect. Just taking steps in the direction of supporting the health of your feet is fantastic. First, on what to wear on your feet is a recommendation to avoid bare feet. And this is just to prevent injury. You want to protect your feet. And so recommending wearing shoes outside and shoes or slippers inside so your feet are protected, and also wearing closed toe shoes and slippers, again, so the feet are protected and you minimize the chance of injury. It's also recommended to wear socks. Wearing socks with shoes is recommended to prevent rubbing and blisters. It's recommended to wear clean socks and change them every day, and this is about preventing infection. Wearing socks that fit well, have no holes and no seams. Again, that is to prevent injury to the foot through rubbing. A note that white socks can make drainage easier to see. So that's something to consider as well as part of your practice of inspecting your feet. And then a note there that compression socks may help with circulation, which is something that also can start to not work as well in our bodies in the face of having diabetes. You don't want to use compression socks, however, without talking to a health care professional about them, because if they're too tight, they can be problematic. What to wear on your feet? A supportive shoe. So you want a shoe that fits securely so that it's not rubbing unnecessarily, and recommended here to use a shoe with laces or buckles so that the fit of the shoe can adjust. Recommended to have a wide toe box, so you can see in the pictures on the screen there, with room to wiggle your toes and space between the longest toe and the front of your shoes, so your toes aren't all kind of cramped and rubbing as you walk and move around. A shoe with cushion, support, and protection. A shoe with a low heel. If your heel is raised up, then your toes are going to be jammed in towards the front of the shoe. And additionally, a shoe without seams that can rub on the feet. Also recommended to put on your shoes before you put them on, to shake them out so that something like a little pebble, doesn't get in there and just kind of rubbing against your foot while you're walking and you're not feeling it. If it's possible, you can rotate the shoes that you're wearing so that no particular part of your body is your foot is getting overly strained for extended periods of time. And then just some notes on buying new shoes. In the blue box there, if you have loss of protective sensations, you may want to look at getting your shoes professionally fitted and possibly therapeutic shoes. There's a really wide range of therapeutic shoes out there now, so customized shoes are not necessary for most people. Just some general recommendations: have your feet measured every time you buy shoes, because the feet can be changing size and shape over time. Buy shoes at the end of the day, because our feet are generally bigger, a little bit bigger at the end of the day, and break in shoes gradually to prevent blisters. What's recommended is to begin with wearing them for a couple hours per day. All right, next section, when to see a healthcare provider about your feet. First point, for annual checks. So you want to have your bare feet checked and screened for loss of protective sensation and loss of circulation at least once a year. Another recommendation is to take your socks and shoes off at diabetes-related visits and ask for your feet to be inspected. And then, depending on what your healthcare provider discovers, if your feet are at higher risk, then more frequent screening is recommended. You also want to see your healthcare provider for treatments. So it's not recommended that people with diabetes try to treat things like corns and calluses, ingrown toenails, warts or slivers themselves. You want to have a healthcare provider support you with these things. And in the blue box there, the note that over-the-counter medications for corns and warts can be dangerous for people with diabetes, again, because of that loss of protective sensation. So these products could be burning the skin without it being felt. You also want to see your healthcare provider for any of the following kinds of symptoms: swelling, warmth or redness, numbness, tingling, burning or pain, loss of ability to feel hot or cold, a blister, sore, ulcer, infected corn or ingrown toenail, changes in the look, shape, color, and or temperature of your feet, or fungus infections between your toes. So you don't want to wait until your next appointment. If these types of things present on your feet, you want to see your healthcare provider right away. Again, most serious foot complications can be prevented, and utilizing the kinds of strategies that we're talking about in this session can really help to do exactly that. Last section of this presentation, lifestyle basics. So things related to overall diabetes management that can help with taking care of the health of your feet. First, balancing your blood sugar. So the more stable you keep your blood sugar, the less likely are you to see the kinds of damage that can lead to loss of protective sensation, loss of circulation. And so while balancing blood sugar is complex and beyond, and going into it in depth is beyond the scope of this particular video, some notes on some of the basics. Follow guidelines for eating well with diabetes, which are generally focused on eating in a way that avoids really large spikes of our blood sugar. Move regularly. So a couple ways moving regularly can help with balancing blood sugar. One is something like going for a walk after a meal actually uses the energy, the sugar that just came into your bloodstream through your meal, and so can avoid quite large spikes. That can be quite impactful. Also, regular movement, especially things like strength training, can help to increase what's known as insulin sensitivity. And when we are more insulin sensitive, our blood sugar is less likely to spike in response to the things that we eat. When we are less insulin sensitive or more insulin resistant, we're more likely to see large blood sugar spikes. So movement can increase our insulin sensitivity. Managing stress. Our stress hormones flooding through our system decrease our insulin sensitivity. And so when we manage stress, that helps to support insulin sensitivity. And sleep is important as well. When we are sleep deprived, that also decreases our insulin sensitivity. So managing blood sugar involves a lot of different aspects of our life. If you want to learn more about these kinds of things, these are a couple programs that might be of interest to you. One through Self-Management BC. They do a 6-week program, 2.5-hour sessions, available virtual and in person. They also have a peer health coaching program where somebody who lives with diabetes and feels like they've got a handle of the self-management thing can be a bit of a mentor one-on-one. And then Diabetes Canada also offers a 2-session program, 1-hour sessions, one led by a nurse, one led by a dietitian. And so if you're interested, you could pause this video, make note of those web addresses and check them out afterward. Similarly, some books, if you're more of a reader than a program taker, these books might interest you. They both focus on reversing diabetes, and that's something that has really only come into awareness in the last number of years, that diabetes is something that can go into remission, especially when people are in a place of having been newly diagnosed. And both of these books lean heavily into using diet as a strategy to explore bringing diabetes into remission. Another really big piece is smoking. So smoking decreases blood flow to your feet. Smoking really negatively impacts on circulation, and it makes it that much harder for wounds to heal. So if decreasing or quitting tobacco or e-cigarette use is something that you're interested in, again, make note of that resource there. It's a free program for British Columbians, looking to take those steps. And then final note here is just day-to-day things that you can do to support blood circulation. Elevate your feet when you're sitting, wiggle your toes and move your ankles around for a few minutes several times a day, and move regularly to improve your circulation. So that brings us to the end of this short presentation. I hope the content was valuable for you. Again, encourage you to write down any questions that you have and take them in to speak with your healthcare provider about.